Thank you, Laura, and welcome everybody. My name is Elise, and I'm a social worker within Recovery Alberta. I've held a few different clinical positions with different clinics through Recovery Alberta. Currently, I'm working at Access Mental Health, and I also do some casual family counselor therapy at the Summit, which is a program we'll actually talk a little bit more about in this presentation. So our objectives, or tonight, we're going to be talking about kind of what is quote unquote normal. What are some warning signs that it may be time to get some help for your kiddo? And then, of course, once you've realized that you need some help, trying to figure out where to get that and what to access. I also will touch on some really common community resources that we recommend, and then also the Recovery Alberta programs that are under the child and adolescent mental health kind of portfolio within Recovery Alberta and how to access them. And as Laura had mentioned, often I find questions come up around those resources the most. And so we'll save those for the end, and I can definitely get into a lot more detail about them if there are any questions. Okay, so first we start with what is normal. And as we, have learned, there is no such thing as normal, but there is a range of milestones and tasks that children and youth meet that would be considered typical. Um, we have, a lot parents often have an understanding of this when it comes to our children's physical development, right? So we have an awareness that by a certain age, our baby should roll over, our children should start walking, talking, that kind of thing. And we get told and educated quite a bit on what that typical range would look like and what would it mean if they were either delayed or advanced outside of that typical range. There are similar milestones and tasks when it comes to social emotional functioning and for children and youth. And they fall on the same kind of continuum where there is a typical range and there is areas where there might be some concern around delay. So there, as I have here, a lot of different child development theories, which you don't need to know. Those are, what we learn when we go to school. However, what is really important and helpful for parents to know is some general ideas of what the tasks may be within their child's developmental stage. And just for the purpose of helping you understand a bit more about why they do some of the crazy things that they're doing, and also help you to understand if there's early warning signs that things may need some help. So when you have that teenager who is changing their hair color every week and has suddenly stopped, wanting to engage with family as much and really spending more time with friends and seeking their identity that way, that can feel really uncomfortable. There can be some tension around that. And it is developmentally appropriate. So, meaning that's an important developmental stage that that child is in. And that can help you understand, oh, my child is doing something that makes more sense. Um, so as I was saying, it can also really help identify if there's early warning signs that things aren't going well. So if you have a youth who is not actually going out of the house and socializing, knowing that that's a really important task for that age can help you understand when you need to get some help. So being able to almost ground yourself or anchor yourself in what are the expected or kind of typical tasks my child should reach. Now, I have linked a couple different resources here that can be really helpful when you are wanting some information about it. The first one would be the Government of Alberta, and that on myhealth.alberta.ca, you can find that growth and developmental milestones. It actually breaks it down by age and has in there some really great kind of short snippets on what tasks for social emotional as well as physical. And then the second one is through an agency called Can Learn Society, and they they're an agency we actually recommend to families quite a bit. They work a lot with ADHD and learning disabilities. But they have this resource page that I found really helpful because it has links to other resources that parents may find important and necessary. Um, and you can navigate through there to find some of the social emotional skills that are important. Okay, so some warning signs and when to get the help. So you've kind of done some information gathering around the developmental stages or tasks, and you are noticing that there might be some dysfunction in some areas. And so when we're talking with parents, we're always kind of wondering about how children and youth are functioning. So what is the impact of whatever they're concerned with? What's the impact on their functioning? So, children and youth, this is their job really is to be in school and to learn how to be social beings. And so, when you notice that there's a lot of school avoidance, and often they're not coming out and saying it's because they're anxious about attending. It comes out either it could come out in defiance, it could come out in some complaints about discomfort, somatic complaints like stomach aches. Um, are they isolating too much? And again, you want to take into account what they should kind of quote unquote be doing within their developmental stage. How are they doing behavioral and emotionally? So, difficulty regulating emotions. So, obviously, emotions we know now are important to be able to feel and express. However, some people really find that that feeling of it is really overwhelming and they aren't quite sure how to express it in safe ways. And we call that regulating emotions. And when you have children and youth who kind of feel almost a bit explosive, right? Where it feels like something really minor, like a minor trigger might, like to you, seemingly minor trigger might set off this seemingly overreaction. And what that really is that child or youth not having a skill that they need in that moment to help that emotion feel more in control and more safe. Um, so that's a sign that they may need some extra help. The decreased window of tolerance, some people may know that term. Um, Really, we all have a window of tolerance. We have this window where, when we're overstimulated, we can get overwhelmed outside that window, and that window of tolerance can really change day by day, hour by hour, sometimes depending on our vulnerabilities, right? If we're tired, if we're hungry, if something really bad has happened in our life that day, so our window of tolerance might be smaller, and then conversely, so if, we're able to, maybe take some deep breaths, learn some skills, we can actually increase our window of tolerance. And if you know that your child who usually, can kind of roll with the punches and is pretty resilient, you've noticed that they've started to get overwhelmed more easily and they kind of can't handle changes and transitions like they used to, that may be a sign that they need some extra help. And how are they functioning? So children and youth, I mean, they often, I mean, adults too, often don't have the words to be able to express exactly what's going on in their minds or in their bodies, but it comes out in physical ways. So poor sleep is a really big one for kids. We see that either like a lack of appetite or perhaps really unusual eating patterns like binging or some restricting can happen. And then somatic complaints are huge, especially for younger kids when they are experiencing anxiety. Um, they don't know how to say, I'm experiencing anxiety. This makes me feel, I'm perceiving my peers are judging me and I'm too anxious to attend school. Instead, what it comes out as is stomach aches and headaches. Often we get referrals from doctors after a parent has gone through all the medical testing with their child because their child is complaining of chronic headaches, body aches, stomach aches. And everything medical's been ruled out. And really what's left is those worry thoughts because they can really impact somatically. So safety. I have a couple slides here on safety because it's a big one. It's definitely a big concern that parents have. Um, I put this stat up here, this quote, because it's important to know that self-harm, which the technical term for it, so you may see it written out this way, is the non-suicidal self-injury. Um, Self-harm is very alarming, and it should be, right? It's a very big warning sign that something's not going well. However, it is relatively common in adolescence and in pre-adolescence. Um, it's a very, there's a lot of different functions, a lot of different reasons that youth use self-harm, and we won't actually know what the function is unless we explore that with the youth because it can be different for a lot of young people. But what we can know for sure is that it's being used as a way to get a need met, right? So it could be a coping skill to try and manage an out of control behavior. It could be a way to kind of wave that flag and say, I'm not okay, and I need some attention to that. So looking at it as self-harm is a maladaptive coping skill. And when you look at it through that lens, it allows you to then get some help to realize, oh, so regardless of the function, this is a clue that my child, my youth needs to learn more adaptive coping skills, right? So things that can help them feel better without all the consequences that are associated with self-harm. Risky behavior. So this one can be tough because, as I said in the beginning, right, youth are going through this crazy developmental stage where they're trying to discover their identity, and they do that in sometimes really painful ways, trying on a lot of different identities and changing friend groups, trying out some risky things. However, if you've noticed that your youth has completely changed their friend group and you don't know who these kids are anymore, or you're a little bit worried that perhaps they're not a really good influence. Um, Substance use, if you are worrying that they're spending too much time online and you've done some kind of digging around and discovered some worrisome behaviors there. Problematic sexual behaviors really refer to for kids under the age of 12, you wouldn't be charged with any kind of, you can't be charged with a crime. And so if there are engaging in kind of some play that has a sexual feel to it, or if they're engaging in sexual touching of a peer, it's referred to as problematic sexual behaviors, and there's a whole set of treatment just for that. So for suicide, this can be a really scary, which makes sense, topic for parents to talk about and to think about for their child and youth. It's really important to understand that there is a difference between thoughts about wanting to die and thoughts about wanting to kill yourself and suicide. And when I speak with children and youth and parents, and I'm doing risk assessments, that's one of the first questions, those two questions. Are you having thoughts about wanting to die? And then I don't stop there. I ask, are you having thoughts about wanting to kill yourself? And the reason really is us humans, our brains, when we're in a lot of distress, and especially when we're feeling helpless, like we don't have much control over a situation or really hopeless, our brains can take us there. We can have thoughts of, some common ones would be, I wish I was never born. I wish that I could die. And it really, when you dig down in a lot of those thoughts, is a wish just for things to feel different, for the pain to stop, for things to change. Not like it, and you can phrase it kind of as if things were to feel better, would you still want to die? And often the answer is no. Um, Now, suicidal ideation, that's the kind of clinical term for just having thoughts about suicide. Those are obviously huge, both thoughts of wanting to die and of suicide are a huge concern and a flag to get help. And the only way to really understand what is going on in your child's mind around suicide or dying is to have the conversation. And it's a tough conversation to have, especially because what we know is the most effective form of this conversation is to really ask those specific questions. And that can be really hard for parents to not kind of dance around the question of, are you having thoughts of killing yourself? Um, but what we know is that having that very specific language is what is going to elicit the response that helps us understand where the risk is and also helps lead into how to safety plan, right? Because that question then can lead to how have you had, what are the plans that you have? When did you have a time frame around this? Do you have the items that you would use? And all of those things are really important to talk about. Now, this is not this is conversations I have daily with people, but the majority don't. And so not knowing how to start this conversation or how to finish it, or sure, you ask your child, are you having thoughts to kill yourself? And they say yes, then what do you do? So I actually have a slide when we get down to some more resources specific to that. So kind of what are the resources out there for any situation related to risk when you want somebody to help you go through a risk assessment, a safety plan with or without your child. Like you can get that help for yourself too, just to be prepared. Um, but we'll talk a bit more about that. All right. So we've covered kind of what are the warning signs and when to get help. So you've, decided, okay, there's that decline in functioning and increase in safety risk. They are asking for help. We have a lot of parents who call us, and they actually, especially for the teenagers, for older teenagers, um, where they don't know. Their child has just said, I really need to talk to somebody, and the parent doesn't really have an idea about what mental health is or about they didn't realize their child was struggling. So if they're asking for help, and then it's important for parents to know that there are a lot of resources out there that they can access to get help as parents, even if their child is not wanting to participate in any kind of treatment. So they can get some parenting support as well. So, where to ask for help? And that brings us to talking about Access Mental Health. So, Access Mental Health this is the Calgary zone, and a lot of people don't realize, but Calgary zone includes quite a few different surrounding communities. So all the way east to Clare's home, north to Didsbury, south to Diamond Valley, and west to Lake Louise. We have clinics in all of those towns that you see, as well as a lot of clinics, obviously, in Calgary. We also are aware of resources in all of those towns that are community resources if a Recovery Alberta clinic is not the right fit. So, what is Access Mental Health? So, we are a phone-based line, and we are open from 8 a.m. and our phones are open until 5 p.m., but we can't do intakes after 4:30, so it's best to call before 4:30 p.m. Monday to Friday. Anybody can call us. We get a lot of phone calls from other clinicians, doctors wanting to kind of brainstorm about resources. We get teachers and we get a lot, actually, I've had quite a few of guidance counselors calling with the youth with them. So yeah, we can facilitate a lot. We answer the calls in live time and process the calls in live time, which means you're never really on hold for that long waiting. You do have the option to leave a message and we'll call you back. But typically there's not much of a wait. So we are also the centralized point of access for referrals to many Recovery Alberta addiction and mental health clinics in Calgary for children, children and youth, but also for adults and seniors. We do have two separate lines. As you saw in that first slide, you kind of get prompted to select one or the other. And each clinician is trained in both. I actually do both lines. I work primarily on the child line, but do a couple days a week on the adult line as well. So, but typically the clinicians are specialized in each of those demographics. And um, so we are aware, obviously, we can do the intake to Recovery Alberta, but we also really keep abreast of the community resources. We sit on some committees where we get updates from community resources. We also get seek updates around their wait times, so we can have information about community non-Recovery Alberta programs as well. So this kind of shows the flow of what happens within Access Mental Health. So we get just a ton of faxes from doctors sending us information about families. And we accept anything really, as long as we have families' demographics on there. A doctor can, and they definitely have. They could just, scribble anxiety and fax it to us, and that would be the same result. Like we would follow this same process for that kind of referral as others. There are some programs, and I will touch on those that require a doctor's referral. But the majority don't. So we also can just, we call them self-referrals, even though it's a parent or guardian calling in. So it doesn't need to be a fax, it can be just a phone call. And then Connect Care, that means nothing unless you're within Recovery Alberta or AHS before it became Recovery Alberta. Um, and professionals who are in recovery within Connect Care can actually send us referrals directly through that computer system. It's your health chart. Regardless, in the child and adolescent world, regardless of how a referral is initiated, we cannot process it to any program until we've spoken to the parent or guardian. So we have to speak with the family. And that's because a lot of the treatment in the clinics that we have is family-based treatment, and we need to get an idea from families what they're looking for, and they also help us understand kind of what the concerns are. So referrals that have been received by a doctor or any professional that's been faxed, they get entered into the child's health chart under the child's name, and a letter is then mailed to physical mail. We say physical for child and adolescent. Mailed to the address that the doctor has provided. And that letter it's a standard letter, lets you know a referral's been made, and invites you to call Access Mental Health to talk about the referral. When we speak with you, we do a brief screening, and if an intake is needed, we do it at that time as well. So we always tell parents it's potentially could be up to 45 minutes for a phone call, but some are 10 minutes, some are really short, but they can be really long. So at the end of the phone call, for the vast majority of them, the plan going forward and all the recommendations are discussed then. There are some where we need to consult. And if that's the case, then we will connect with the family. We'll call them back with what the disposition is, the kind of what the determination or what makes sense. But the majority of the time, you'll actually receive either recommendations for community resources or you'll have an intake to a Recovery Alberta clinic. If the disposition is community resources, we will give you all the information that we have on how to contact it, but those are all self-refer. So that means regardless of if a doctor sent something in, it's the family who would then follow through with doing the referral to the community resource. So a couple things. When we speak with you, the questions that we ask, we're really focusing on, we do have some questions historically, typically around what kind of treatment's already been done. Obviously, we don't want to repeat things you've tried, but a lot of it is really around current concerns. So, you know, Decline in functioning is a big term we use. So how long, has this been going on? Um, how long have the symptoms been worsening? Have they getting worse? And the kind of pre-screening questions, asking about those really help determine whether or not we should go forward with a full intake. And then if we do go through a full intake, the point of that is to capture enough information to determine eligibility for a clinic through um, Recovery Alberta. They also are used if we do send something to a clinic. The therapist there will have the intake information with them, and it can help guide your initial appointment there. Now, consent is a really big deal with Recovery Alberta and can sometimes throw a bit of a wrench into things, particularly when we have two legal guardians who disagree about treatment. So, regardless of custody, each guardian has a right to not consent to their child's going to a clinic through Recovery Alberta. So, all legal guardians must consent. We don't have to speak to all legal guardians, we just need to speak with one. And we'll always ask them if the other parent or guardian is aware of the referral and in agreement with it. And if they are, that's great. We proceed. Once they're at the clinic, if there is a parenting order, they ask to see that. But on the phone, we take your word for it. But if you let us know, actually, we don't want them to know, or there's absolutely like they refuse treatment, they refuse therapy, and unfortunately, this does come up more than we would obviously want. And in that case, we're not able to proceed. Parents can go to court and get a sole decision-making rights is kind of the wording that typically goes into their parenting order. Um, but we aren't able to proceed if we're aware that another guardian doesn't agree. Now, for youth within Recovery Alberta, within AHS, it's always been there's ability to do a mature minor assessment, and that's for any type of interaction that someone through Recovery Alberta or AHS has with a youth. They can do a mature minor assessment, and what that is basically assessing if that we believe that that youth can make their health decisions. Um, and provide their own consent without having to involve parents or guardians. There is no hard and fast age to a mature minor assessment. It's very much a lot of clinical judgment is used with it. There is a tool that helps guide us through some of the aspects of it, but when we're doing a mature minor assessment, we're really focusing on the maturity level. So wanting to understand their development, um, and they're living kind of their demonstration of independence, their demonstration of being able to follow through, and their understanding of what the treatment is. Um, Mature minor assessment, once if someone had, like if we declare somebody a mature minor, we're declaring it just for this phone call. So when they go to the clinic, they would have to go through the assessment again. And if something has changed, such as they now are actively suicidal, they would not qualify for that anymore. So it's important to understand, even if we have declared a mature minor, it's just for that one interaction that we're doing. Um, and like I said, there's no hard and fast age, but it would be really hard to be able to meet all of the maturity thresholds if a youth was under around 15, I would say 15, 14. So we do have many factors when we're recommending services. We're always looking at the severity. So all of our clinics are moderate to severe dysfunction related to mental health. Um, we're obviously looking at the family's goals and the type of service. There's limits to what Recovery Alberta provides, and there's a huge range of what's available in the community. So we're always kind of wondering, well, what it is that a family wants. For instance, some families really love the opportunity for virtual or evening access, and that's not available through Recovery Alberta. So we know the programs to focus on where that is. Um, This CalLocus, so we actually have a standardized tool that helps us determine the level of service intensity when we're doing an intake. And so that's always taken into account. Um, Obviously, like we're determining eligibility based on program inclusion and exclusion criteria. That's why a lot of professionals also call us because those inclusion and exclusion criteria for clinics can be pretty dicey. Like it's kind of hard to remember all of that in other roles, but that's our role to know that. We also have access to a database that when we forget things, where it's easier, we know where to look to find them. So if we don't know the answer, we know where to look. All right, so these are some common community resources. Now, this is definitely not exhaustive. I put on there the ones that typically um, we typically find we end up recommending. Um, if we at Access Mental Health, we don't ever provide um, specific private therapy options. The only options that we'll ever recommend is um, if they offer a sliding scale or subsidy, so or free therapy. So, for instance, one that we often recommend quite a bit, which I actually just realized I don't think is on there right now, is an agency called Cultivate. And that's like a private therapy agency. However, they have a pay what you can model for therapy. And so that's one that we can recommend. And there are a couple that we are able to recommend for that reason. If families have employer health benefits and they're super eager to kind of go the private route. Like I said, we can't recommend specific private therapists, but we're able to help guide where to find those. So there's a website called psychologytoday.com that we recommend where it's kind of a portal where families can look up different clinicians that are private therapists and know that they're who they say they are. So whenever, regardless of, like I said, kind of before, regardless of if the family has called in wanting therapy resources or the doctor has sent in a referral asking for therapy resources, if the dispositions, the recommendation is a community resource, regardless of how the family was referred, the family is the one who has to call and self-refer for these resources. We'll give you the phone number, but you guys are the ones that then would have to call. So again, if there's any questions about what you see up here or any specific questions about resources, definitely save those questions for the end and we can brainstorm together today. Okay, so within Recovery Alberta, there is kind of an umbrella term called CAMP, and it stands for Child and Adolescent Addiction, Mental Health, and Psychiatry Programs. And under that umbrella of camp, there are a collection of clinics. All of them really follow this flow. So they all have their own mandates, their own kind of reasons for their treatment and what they offer. But they follow the same flow. So when you are part of a camp clinic, your initial assessment is really that's where you build your treatment plan. And that treatment plan will include um, the type of therapies that that clinic offers. And and then the treatment plan will be very specific. So all camp clinics are very goal oriented and recovery based. So that means they're always kind of working towards making sure that progress, that success, that meeting goals is being measured, and that you're not in therapy forever. So you would come, have a particular goal and treatment plan, and then once you've met that treatment plan, be discharged. Now, obviously, life doesn't follow a flow chart. And so after discharge, a lot of people need to, things come up. Perhaps, things felt like they were pretty doable when you were doing them with a therapy appointment every couple of weeks. But without therapy, you're struggling. Um, for clinics that exist under camp within Calgary, you have 6 months from the time that you last met with your therapist to just call the clinic back and start this flow chart all over again. So go right back to assessment where you talk about what your needs are and see if treatment at that clinic makes more sense or if treatment somewhere else makes more sense. So you don't have to go through the whole referral process, the intake process with Access Mental Health, unless it's outside of that 6 months. For rural, it's 3 months. I don't know why there's a difference, but within rural, it's 3 months. Also, within the adult world, it's 3 months, but for child and adolescent in the city, it's 6. So within camp, probably the bulk, not probably, the bulk of referrals for when we have moderate to severe dysfunction related to mental health, we will do an intake for a camp community clinic. And these are all the locations for them. So within Calgary, there's three, and then every single town has their own. Within Calgary, those three are specific to child and adolescent. Within the rural, they span the lifespan. So it's up to senior. Um, they do have clinicians, most of them have clinicians that are specific just to child and adolescent, but they're all out of the same clinic. It's important to note that community clinics are therapy driven. So they only really make sense if what the child and youth is looking for is insight-based talk therapy. Um, so when we're going through an intake, if it's primarily a concern around behaviors or family conflict, um, that or even parent-child conflict, that would not be a good fit for a community clinic because what would make more sense is some behavioral therapy or family therapy, that kind of thing. Um, but for the community clinics, it's moderate to severe and it's related to the child's mental health. Um, when you're going through that initial assessment and you're building your treatment plan, it will always include that connection with that therapist. But then also from time to time, um, they always have groups running various different groups related to anxiety. They do have some parenting groups. And they can definitely still do family work. Obviously, your child exists within your family, but the family work for these clinics is really around supporting the child's mental health. Um, they also have the ability to refer to psychiatry. Now, psychiatry at our community clinics is quite limited, meaning that it's always the therapist who would refer to the psychiatry. Um, and there may be a long wait for it, or it may not be, they may not meet with a psychiatrist as many times. So it is very much a therapy-driven program. The child and youth motivated to engage in therapy for adolescents, so over the age of 12, that's really important. For under the age of 12, family needs to be engaged too. So it's really difficult for children who are younger to take what they've learned inside a therapy office and then generalize that skill to their environment independently, right? They really need somebody there to coach. And so the parents would be involved in a lot of the treatment. And also the motivated to engage in therapy, like we're not like we get teenagers and children and youth. Um, they often aren't like, woohoo, super thrilled about having to go to therapy. They may be a little bit nervous about it. 100% as long as they're willing to try the therapist, even if they make that therapist work for it, that's part of our treatment is to build that rapport and get them engaged. Okay, so these are all of the clinics that Access Mental Health refers to. And you can see beside each clinic is different acronyms because it's alphabet soup within CAMP, which is alphabet soup itself. Um, but the blue denotes the ones that are kind of fall under that CAMP umbrella. What surprises a lot of people is that we actually refer to some programs that aren't even a part of Recovery Alberta. And one of them I have an actual full slide on because it's a pretty popular one to talk about. So again, these clinics, so the community clinics we just covered, they capture a very broad range of mental health disorders, and they capture the majority of them. And then, if that kind of treatment is not successful, then there are specialty clinics to manage those mental health diagnoses. And if you have questions about any of those, definitely we can talk about them after. Um, we do intake to them, but they also can be internally referred through a camp clinic. So if you're connected with a community clinic and perhaps you're doing some really good therapy with to treat OCD symptoms, however, you've done a course of treatment and things are not improving, they may refer internally to the OCD clinic. So the three programs I have up here highlighted that we do referrals for that are non Recovery Alberta clinics. The Compass, it's through an agency called YW. That's an in-home support program that also can bridge some connection to the school. So that one would be for kids uh, grade 5 and under, grade 4 and under who have pretty significant behaviors. Um, Eastside Extended Services, we have a contract with Woods Homes, Eastside Community Mental Health, that can provide a chunk of therapy at no cost. And then Strongest Families, I'll get into more information. The orange highlighted their adult programs that we do intake for. They all have a pretty like 16 plus age, but there is some wiggle room on some of them. And I will talk a little bit more about the psychiatry piece there. So there's about a trillion other programs through Recovery Alberta that we don't do a referral to. However, and we get a lot of requests for things that we don't do intake for as well. And so we're able to help families navigate that because the system can be pretty tricky. And so we can help families and doctors. So we often, if a doctor sends us a referral, we get a lot of referrals asking for autism spectrum disorder, ASD assessments. Um, we get a lot of referrals for the eating disorder clinic when in fact it's more related to like severe pickiness of eating or more of a sensory issue. We're able to help doctors by sending them a letter and letting them know how to refer to that. And if it's something that is a self-referral, we're able to help parents access that. The one thing that's really important to understand about Recovery Alberta clinics is there's no ability to refer to residential treatment or inpatient units. So Recovery Alberta does not have residential treatment. Um, they have inpatient units that are in the hospital and they have a few that are in the community, but those are all accessed through the emergency room, and that would only be when there was a significant imminent risk, typically related to suicide. Um, if there's more questions about those kind of resources, I know a lot of information about them too, but it's just important to know that that's not something we can do an intake for. All right, so back when we were talking a bit about risk, I had mentioned I had a slide that can help you understand a little bit more about where to get help for risk assessment risk assessment and safety planning. So there's a lot. If you can see on here, there's quite a bit. So the first one, single session. Now, I do have a slide next about the single session that's offered at the summit. Um, but there are other resources as well. So both the South Calgary Health Center and the Summit have single session, um, and that those are through Recovery Alberta clinics. And then Eastside Community Mental Health and an agency called Kindred have this rapid access counseling, which is a single session model but not within a Recovery Alberta clinic. Um, so single session is really good when you have a very specific issue, target, something that you need to talk about, and you'd really like to get in quickly. You may not need multiple sessions. You may not know what you need. Your child may not know what they need, um, but you need to talk to a therapist. So you're able to get in quite quickly. The summit is truly a walk-in. It's kind of like a walk-in clinic, but for therapy. So you would get in that day. And then the South Calgary Health Centre, Eastside, and Rapid Access, you can schedule. You can book them either by calling or using that website that's there, that Community Connect YYC. You can actually book directly with that agency for rapid access counseling. So those are really good if you've got a concern that you really want to address quickly, um, but not this may not be urgent. It may not be a crisis. For some, it sometimes is for sure. Um, if there is urgent mental health, and that's kind of moving along the continuum here, the in-person, so South Calgary Health Centre also has that urgent mental health. So does the Schumer. And then all of those places that you see there are the urgent cares in those rural places also have urgent mental health. Those would be, it's urgent, and so kind of similar to how you would present to urgent care if you were ill. It's not to the point where you need to go to the hospital, but it's more significant than waiting for a doctor's appointment and perhaps scheduling a walk-in appointment at a walk-in clinic, such as what single session would be similar to, is be too much or too long. Now, if going in person is either not available or would be not necessary, there are crisis lines and crisis outreach. So the two crisis lines I put up there, the Distress Center is a 24/7. That's for all ages. And they also have access to a crisis outreach team through Recovery Alberta called the Mobile Response Team, MRT. So the distress center, really helpful. That's when you're in crisis. And Connect Teen is kind of a sub, and it's a really great number to pass on to youth. They can text or they can call, and they're paired with like a youth peer mentor who's gone through training that can really help them. Now, those crisis lines and crisis outreach can be really good if you are not sure. So let's say you've had that chat with your child about suicide and they said, yeah, I do think about it. And you're kind of not sure where to go next. What's really important to know is if it's imminent risk. So if you feel like you can't keep them safe. So if examples could be they're very specific, they are, yeah, I want to kill myself and I'm going to do it today and I'm going to use this object and I have access to it. That's really imminent, right? They're not really talking about safety planning too much. They've really put a lot of thought and planning into this. And it's important to know that if it's imminent, if you really feel scared and you can't keep your child safe, you call 911 or you take them to the hospital. And there's assessment at Children's, Foothills, and South Hills campus for child and adolescent. They have mental health teams there. If it feels like talking to your child, you kind of don't know where to go from here and you want to be seen in person, the summit is really good. They can do a really wonderful risk assessment, and the risk assessment that they do can help you decide about whether hospital or not. So they'll actually give an opinion on, we believe your child would benefit from inpatient, and they can help communicate that to the hospital. However, they're not open 24/7. They, will cover their hours in the next slide. So again, 911 or take them to the hospital if you need to. And another really important one, if you're not sure what to do, you don't want to leave the house because you can't get your child out, but you don't think you're quite at 911, the East Side Mobile family crisis support is a really great number. So Eastside Community Mental Health has a lot of services. They have single session, which is up there. They have that extended East Side counseling that we can do an intake for, but they also have a crisis line, which then it's all at the same phone number. But they have this ability for folks to call, or parents to call when they're in crisis. And that crisis could be the risk assessment and safety planning, but it can also be out of control behaviors. So if your child's having a really massive outburst, meltdown, you're not sure what to do, you can call them. They can sometimes even come out to the house and offer some intervention. Um, they are open until 11 p.m. though, so they are not a 24-hour service. So again, these are the places that you can access if you need some of that additional help around the conversation around suicide, or if you have questions as a parent about, this is what I'm seeing, should I be worried? And then also about safety or safety planning. So, okay, so we've identified there's some risk. How can we safety plan so that this doesn't end up in the hospital? So I just wanted to expand a little bit on the summit because I know that it's a program that a lot of schools know about and talk about, or it's a center. It's relatively new within Recovery Alberta. The only program within Summit, they have three, but the only one that's accessible for kind of the public, for families to access, would be walk-in single session therapy. The other two programs that are there are only referred to either through a hospital admission or through an internal Recovery Alberta program. But the walk-in services is really great. So it's 7 days a week. They just recently reduced their hours on the weekend just due to a lack of foot traffic there. But they are open the last session at 7:45. If you arrive at 8:50 and need a risk assessment, they'll help you with that. But an actual therapy session would have to start at 7:45. Um, they are a true walk-in, so you can definitely call ahead to see if there's other people waiting, but you can't book an appointment. They do have a multidisciplinary team. However, when you walk in, what you are getting is a therapy session with a family counselor. Um, and then that family counselor can consult with a multidisciplinary team and pull people in if needed. Um, they could do a great job with assessing for risk and doing the safety planning, but they're also really great for single session, meaning coming with a specific problem that you can talk about and come up with strategies in the moment. So it's not meant to fix everything, right? It's single session. They're a little bit longer than a typical therapy session, and they seek to find a solution, very solution focused, to find a solution within that session to what these concerns are. They also give really great recommendations. Another program that I really wanted to highlight because it's one that is quite popular, it's very accessible, really low barrier, and we at Access Mental Health can do intake for it. So that means that it's free, and there wouldn't be a wait. So it's through an agency called Strongest Families. They're a Canadian program. You can look them up. They have quite a few different streams, but the ones that we have access to is a behavioral stream. So often the children in that stream, they're age 3 to 12, and often they're diagnosed ADHD. They don't have to be, but it's really struggling with defiance. And then when that defiance is challenged, they can have these outbursts that can be pretty aggressive sometimes. Um, and then they have two different streams for anxiety, starting from age 6. So 6 to 11 would be really focused on parenting. So it would be a parenting program, whereas the ages 12 to 17 really focus on working directly with the youth. All of these streams are virtual. So what that means is the families are provided with all of the material for a behavior program or an anxiety program, and then they're provided with weekly phone coaching on how to implement that program in their home. Approximately 4 months. And what's great about them is that the parent coach that they're matched with works around the family schedule. So there is availability for some evening appointments. So Strongest families, if that's something that parents are interested in, they just have to call us. There's no other referral needed. What we would do, like we don't do the full intake for strongest families, they do their own, but we screen. So we make sure that it's the right fit, that it's what families are looking for, and that it's also a fit for what the strongest families can deliver. And then we will process that referral. Over to that program, and they'll contact the families within a couple days to get started. Um, yeah, so okay, psychiatry. So psychiatry is another area that a lot of people have questions about, and so I thought I would cover that just a little bit. So psychiatry, there's multiple different ways that you can access psychiatry within the system. And a lot of the time, referrals for psychiatry get forwarded to Access Mental Health to us at Access because we know how to navigate all those different routes. So the three really our clinics have psychiatry at varying levels. There's some clinics where they're very psychiatry focused and some where it's more of an adjunct service. But all of them are referred to by the therapist who's connected with the family. So none of our clinics have ongoing psychiatry alone. They always have to be also connected with therapy. We do have access to a couple different clinics that are a consult. So what that would mean is that the child or youth, depending on their age, there's two different clinics that we can send referrals to. The child or youth would have a full psychiatric assessment for the purpose of clarifying diagnoses and giving recommendations for medication. Um, that has to be referred to by a doctor. So we do intake for these, but we can only do intake if we've had a doctor send us a referral asking for that, or just has sent us a referral. And when we speak with the family, we're like, oh, this would be really, really helpful. But we just have to have a doctor, and they also have to have a family doctor. So it can't be no family doctor, but coming from an ER doctor. Um, it's one-time consults. So what that means is the psychiatrist will not follow the child or youth. However, both programs have an ability for the doctor who asked for the referral to consult again with the psychiatrist. And then there's private psychiatry. Private psychiatry, it's still free and covered with Alberta Healthcare. They're medical professionals, and they have to be referred directly by your doctor. Um, Typically, we recommend private psychiatry if families are really interested in only psychiatry and they want it ongoing, not just that one time. And also for when it's really mild to moderate concerns. Some common ones would be just wanting an ADHD assessment and recommendations for medicine. We would say, oh, that makes sense for private. Your doctor has to refer to a private psychiatrist. They often don't know who to refer to because there's a lot for them to have to know. So they send it to us. We do maintain a wait, or not a wait list. We maintain like a spreadsheet, a list of psychiatrists who work in private practice and who have said that we're able to provide their information to a doctor to refer. So if private psychiatry ends up being the disposition, we would send your doctor a letter with about 3 names of psychiatrists who are accepting referrals. And the wait times aren't terrible. There's some currently, right now, there are some that are within a couple weeks, within a couple months, so it's not terrible. Um, it's important to note that Recovery Alberta, both at clinic and consult, those one-time consults will never do a third-party assessment. So basically an assessment for the purpose of applying for something. But private psychiatrists, some of them will. Some will charge a fee. Some will do it for free depending on what it is. But if that's your primary concern, that's probably where we would recommend you go. Okay, so just the last little bit here is to cover what is not provided by camp clinics. So within Recovery Alberta, what we refer to and what is offered through the Child and Adolescent Mental Health umbrella would be ASD assessments. We don't do ADHD assessments. ADHD obviously is comorbid, meaning it exists beside other mental health concerns, and we 100% can treat ADHD symptoms that are comorbid, but if the primary concern alone is an assessment for ADHD or to manage mild to moderate ADHD symptoms, then it wouldn't be through Recovery Alberta. Psychoeducational assessments that we get a lot of requests for, we do not, none of our clinics have that as part of what is offered. Those unfortunately do have to be either done through a school, which has really limited resources for them, so typically done privately. When we get requests for those, we do have a couple recommendations of lower cost and ones that can offer some bursaries or subsidy around those. So for sure, we can have questions about those. So psychiatry only, without therapy, ongoing, we don't have that. And then certain types of therapies. So um, a big one is that family counseling. Luckily, we're really blessed in Calgary with having some really good family counseling resources that we would recommend for that. That mild to moderate severity, and then the behavioral as primary target, those would not be things that we would do intake for. And again, we would end up focusing on community resources. Right. So this is how to reach us. One phone number, but you can choose extension 1 or 2. One is for the child and adolescent. In the side there, I just have for the rest of the province, basically. So Edmonton, they have their programs quite separate between their child and adolescent and adult. So I put both of those up. And then there's just one phone number that we call the provincial access addiction and mental health, and that covers the other zones. So the rest of the province, there's Calgary zone, there's Edmonton zone, and then there's everybody else with the north, central, south. And if you're outside of a Calgary zone, we can get you connected to that number, and they have a similar process. All right. So I did have a couple references there, and there we go. That would be our presentation. Were there any questions?